In this segment of the course, we're going to begin to talk about biological approaches to treatment of schizophrenia. We've talked a little bit already about the neuroscience of the disorder, about some of the changes in the brain that are often associated with the diagnosis of schizophrenia. And what I'll be doing today is focusing more on looking at what medications are most effective in the reduction of symptoms of schizophrenia. It's clear that the first line of treatment for symptoms of schizophrenia is the use of antipsychotic medications. Antipsychotic medications treat two major aspects of the disorder of schizophrenia. They treat or affect delusions, and they have an influence and can affect hallucinations as well. So those two positive symptoms, what we've described before in the course as being examples of positive symptoms, are affected by antipsychotic medication. It's important to also know what aspects of the disorder are not affected by antipsychotic medication. That is to say, the negative symptoms that we've talked about, the cognitive difficulties that we've talked about, the social cognitive difficulties that we've talked about in the disorder, they are resistant or tend to be much less responsive to the effects of antipsychotic medication than are the positive symptoms of delusions and hallucinations. So, as should be clear from this description, the appropriate treatment of people with schizophrenia involves a comprehensive approach in which both medications are utilized, antipsychotic medications are utilized, but very carefully in coordination with a variety of psychosocial interventions that we will be talking about in the course, to really try and attempt to treat the entire client with the disorder and address the vast array of difficulties that people with schizophrenia may experience. As we talked about in a previous segment, it has been shown in a variety of studies that antipsychotic medications appear to have their effect by affecting a substance in the brain known as dopamine. The last idea that I would like to share with you is the most recent data that really suggests in a much even stronger way than what I've presented to you so far that the effects of these antipsychotic medications appear to be through their blockade of these postsynaptic dopamine 2 receptors. These are studies that have used a technology called PET, positron emission tomography, and like fMRI, which we've already talked about, it measures activity of the brain. It's not measuring structure, but rather activity of the brain. In these PET studies, there are intravenous infusions of a molecule that is radio-labeled, that it is radioactively labeled. It is infused into the blood, and this molecule is selective to bind to those postsynaptic protein receptors that we talked about earlier. So these dopaminergic postsynaptic receptors are bound to by this chemical that we introduce into the bloodstream that is radioactively labeled. This allows us to create an image by the radioactivity that is emitted of the areas in the brain that have the highest density of these D2 receptors. These studies have revealed several interesting findings. One interesting finding is that in people with schizophrenia who have been administered these radio-labeled molecules, these radio-labeled molecules that are located specifically in the striatum, the degree to which these radio-labeled molecules are displaced gives us a sense of how many receptors there are or how much dopamine activity occurs. That is to say, if dopamine is stimulated in the striatum, we would expect larger amounts of this radio-labeled chemical to be removed from the receptor sites because they get displaced by the dopamine which is being transmitted. In these studies, they found that when you administer a drug that increases dopamine levels, people who have higher symptoms, higher levels of delusions and hallucinations show more displacement of the radioactively labeled molecule, suggesting that these increases in symptoms that are associated with a challenge or a increase in the amount of dopamine that's transmitted in the brain relates directly to the increase in symptoms that you see in these folks. Another way that people have tried to look at this is to look at folks just at baseline without any type of stimulation of dopaminergic activity, and just ask the question, to what degree do these radio-labeled receptors, to what degree are they occupied by these molecules at rest when we decrease the amount of dopamine that's being transmitted? And sure enough, people with schizophrenia with higher numbers of symptoms or higher levels of symptoms tend to show higher levels of radioactivity at these postsynaptic receptors. Again, suggesting that there may be more activity, or there just may be the presence of more dopaminergic receptors in people with schizophrenia. These findings are very important because they are occurring in the living brain. These are in people with schizophrenia who are obviously suffering from the disease, and you are actually measuring the levels of dopamine transmission in the living active brain. So for this reason, they've been thought to be very, very important.